everyone, my name is Melinda M., and I will be comparing healthcare systems between the United States and Switzerland. Main goals and priorities. For the priorities and goals of the United States, it is a kaleidoscope of financing, insurance delivery, and payment mechanisms that remain unstandardized and loosely coordinated. There are a patchwork of providers increasingly consolidated. A market-driven economy invites the participation of numerous private entities to serve these functions. Payers are mostly employer-based private insurance plus Medicare for 65 and up and Medicaid for low income. The U.S. healthcare also emphasizes heavily on medical technology. There is a large investment in biomedical research. There is also a bias in reimbursement towards procedures, technology, acute care, and institutional care. In Switzerland, the main priorities and goals meet the important goals of good health outcomes and universal health coverage. In general, Switzerland has excellent quality of healthcare and everyone gets the best available healthcare with physician visits, hospital care, pharmaceutical devices, home care, medical service and long-term care, and physiotherapy covered, and everyone gets access to the healthcare needed. Health system and insurance schemes. In the US, the health system and insurance, there is a blend of public and private involvement in the delivery of healthcare. A majority of the system is in private hands, and government is only involved with those unable to afford the private sector. Public health insurance includes Medicare for adults ages 65 and up, and certain residents with disability, Medicaid for some low-income adults and children, Children's Health Insurance Program for low-income children, also known as CHIP, employer-sponsored private insurance, individual private insurance sold on exchanges, Veterans Health Administration, and TRICARE for members of the military. In Switzerland, their health system and insurance are organized into two types. The first type of insurance is the basic health insurance. Switzerland provides national health insurance, which is provided by private nonprofit plans competing on regional exchanges. The second type of insurance is for-profit voluntary insurance. These are for services not covered by mandatory insurance and free choice of hospitals/doctors and preferred hospital rooms. Insurance coverage. The United States does not have universal health insurance coverage. Nearly 92% of the population was estimated to have coverage in 2018, leaving 8.5% of the population uninsured. In terms of services covered, there is no nationally defined benefit package covered. Services depend on insurance type, but most of the insurance types cover hospital inpatient care, outpatient hospital services, long-term care, laboratory and diagnostic services, family planning, nurse midwives, freestanding birth centers, and transportation to medical appointments. States may choose to offer additional benefits, including physical therapy, dental, and vision services, but are not under the insurance above. For Switzerland, health insurance is mandatory. Citizens are legally required to purchase insurance, and the cantons ensure compliance. Coverage includes most physician visits, hospital care, pharmaceutical devices, home care and medical services in long-term care, and physiotherapy. Supplemental private insurance can be purchased for services not covered by mandatory health insurance to secure greater choice of physicians and to obtain better hospital accommodations such as dental care, private, and alternative medicines. Raising money for insurance. In the U.S., to finance insurance, there are different methods to finance these insurance. Medicare uses payroll tax shared by employees and employers, premiums, federal general tax revenue. Medicaid uses federal and state taxes. Private insurance uses premiums paid to insurers, federal tax finance subsidies for plans sold on exchanges. And in Switzerland, since there is mandatory insurance, it is provided by nonprofit insurers competing on regional exchanges with community-rated individual premiums, general taxes, and social insurance contributions to finance healthcare. Health service providers. For the U.S. and Switzerland, they provide the same health services. These include physician education and workforce, primary care, outpatient specialist care, after-hours care, hospitals, mental health care, long-term and social supports. However, each country's insurance systems pay them differently. In the United States, primary care are private and paid mostly by fee-for-service, some capitation and incentive payments, and mostly there is no gatekeeping or patient requirement to register. For hospitals, they are mostly nonprofit with approximately 56% are nonprofit. The remainder are public or for-profit. They are paid through a mix of fee-for-service, case-based DRGs, per diem payments, depending on the insurer, and some bundled payments and PFP programs in Medicare. For Switzerland, for primary care, they have private providers and are paid mostly from fee for service. There are some capitations in managed care plans, but there is no gatekeeping or patient requirement to register, except only in some managed care plans. In hospitals, for public and private hospitals, there are case-based DRG payments for inpatient care and fee-for-service for outpatient care. Health costs for the insured. In the US, private insurers have introduced several demand-side levers to control costs, including tiered provider pricing and increased patient cost sharing. Private marketplace plans have premium subsidies and lower cost sharings for families with low middle income. And all private plans have no cost sharing for some preventive services. For Switzerland, since it is universal health coverage for primary care, specialty care, and prescription drugs, the annual cost is 3,200 Swiss franc per adult, which is equivalent to $2,645 in the US. There is no cost sharing for maternity care and some preventive care, and there's no copay for inpatient care for children and young adults in school up to the age of 25. And that's the end of my presentation. To learn more about the differences in healthcare systems between other countries, you can use the website in the description below.